Hello. Hi. What is long COVID and how long does it take for you to recover from COVID-19 infection? This is Dr. Shabnam Daskar. I'm a functional medicine consultant. I live in Alberta in Canada, and my medical practice is mostly in India. So, it's been more than a year now since we've been going through this pandemic. And obviously, the question comes how long, if you've already been infected by this virus, you've recovered, how long does recovery take, and what does the process look like? And the bottom line is, we don't know everything about this virus as yet. But while we do know a few things, one of the things is, so what is the difference between COVID 19 and the virus? So, COVID 19 is the disease, and the virus that causes it is the SARS-CoV-2 virus. So, just a recap of what you already know. And the SARS-CoV-2 virus has been found to affect almost every organ in the body. Now, what happened is, what is long COVID? So, this is a definition from the National Institute for Health and Care Excellence in the UK. So, people who have signs and symptoms that develop during or after an infection consistent with COVID 19 that continue for more than 4 weeks and are not explained by an alternative diagnosis. So, basically, these are people who have had COVID 19 before, but they have had symptoms which cannot be explained by any other condition. Now, why does it say that these are signs and symptoms that develop during or after an infection consistent with COVID 19? It turns out that it's all over the world, testing has not been uniform. While in some countries, almost everyone who has a few symptoms suggestive of COVID 19 have had access to testing. However, if someone has had relatively mild symptoms, many of you have probably, self-isolated at home and not gone for a testing. So the bottom line is, uh, some of you have been tested even when you've had a mild infection. However, if you've had to go to the hospital or you were in the intensive care unit or any of the severe forms of COVID 19, you've definitely been tested. Bottom line is, there are people who may have had COVID 19 but haven't been tested. So how did all this come about? Now this is where it's very interesting, because patients who have had COVID 19, they were the ones actually who made the healthcare world aware about what was really going on. So what happened is, what are some of the common symptoms of COVID 19? Now, this is actually a group of people. And again, this is where I'm so excited about citizen science projects, because these were people who had recovered from COVID 19, recovered in the sense, if they were in the hospital or ICU, they were back home. They may have tested negative as well. But while they were kind of supposed to feel okay, many of them reported that they were not feeling well. So, this was actually an online survey, and this is a big online group called the Body Politics Support Group, and they are supported by the University College of London. Now, this was an online survey, and this is available free access, open access on the internet, so you can go and access that. A group of patients who said that these were the symptoms that they were experiencing. And this was about a group of about 640 people. And this was way back in May 2020. Now, never before did I imagine that in the medical world, I would say way before, in May, because in medical terms, it's always few years. However, this virus has taught us so many lessons. So, what were some of these? Are the 62 commonest symptoms they felt. The commonest symptom was actually fatigue, brain fog, and you can see it from this list. Some of them had tightness of chest, shortness of breath, chills, sweats, body aches, dry cough, elevated temperature. Brain fog was again then gastrointestinal symptoms, gut symptoms, loss of sense of smell, and as we know that loss of sense of smell and is one of the earliest symptoms of and is an indication of the COVID 19 infection. So, bottom line is, people were experiencing a whole bunch of symptoms. And a lot of doctors found it difficult to explain that. However, in the functional medicine world, we know that Given that viral infections do cause, sometimes what they call a post-viral syndrome. So people have experienced in other viral infections before, not the SARS-CoV-2 virus infection, but people have experienced, after a viral illness, they have, fatigue and muscle ache and body ache and things like that have been common in the past. So it's not that this is something absolutely unknown. Yes, there is still a lot about it that we still have to figure out. So bottom line is, people were experiencing these symptoms and they couldn't explain it, based on whatever else was going on with them. The sad thing is, because again, this virus has is so new that even as healthcare professionals haven't been able to always figure out everything in a short span of time. Unfortunately, many of these people, when they went to the doctor, they were told, oh, it's all in your head and it's just the anxiety you're feeling. And some of them were like, this was trivialized. And unfortunately, many of these people felt they could not go back to work, but then officially they were supposed to have recovered from the COVID infection. So very sad, but it is true. And it can happen. And that is, in one paper, rightfully pointed out as medical gaslighting. So you're just being told, it's like, oh, don't worry about it, it's not. But this entity of long COVID does exist. So, bottom line is, if you are someone who is experiencing these symptoms, there is an explanation for that. However, we may not know everything about it. So, at this point in time, and again, this group has probably they have had another survey, which hopefully they will come out with the report very soon. So, what are some of the features? One is all these symptoms you may feel. The next is, so again, there is no one true picture of long COVID. Some people have called it, post COVID syndrome, COVID long haulers. But finally, because for the in the interest of research, it's easier when you have one name. So the name has been called long COVID now. So these are clusters of symptoms. So some people have said that, and interestingly, a lot of the people on that survey were also themselves healthcare professionals. Some were doctors, nurses, others working in hospitals who've been at the front line of the infection, COVID-19. So some of the symptoms were overlapping. Like let's say one day they felt profound fatigue. The next day it could have been, a racing heart rate, or it could have been something else. Another day, maybe it was a gut symptom. So they were overlapping, and sometimes they were in clusters, and there was no one true, just this was the only exclusive symptom of long COVID. Then symptoms fluctuate and change over time and can affect any system in the body. We know that this viral infection can affect anything starting from your heart and brain and, lung. Of course, it is considered to be a respiratory virus, but then that is the way it enters, but it can affect almost every organ in the body. We've had people talking about skin rashes, and the very fact that one of the earliest symptoms is a loss of sense of smell, that does tell us that the nervous system is probably one of the earliest to be affected, because sense of smell is a nervous system function. And we know about all the people who've had, problems with their heart rhythms and, heart muscles. And we also know that people who already have diabetes, hypertension, heart disease, these people have been more vulnerable to a severe COVID infection. So if you have any of these conditions, your chances of having a more severe infection, being in the ICU, worse prognosis is higher. The other interesting thing is, people who have experienced these long COVID symptoms, it's not necessarily restricted to those people who were in the ICU or who had to be hospitalized. So even people who did not have a very severe form of the disease and they recovered, just by self isolating at home, even they have experienced long COVID. Because logically, we would think that someone who's had more severe disease, who's had a higher viral load, would be the ones more, at a higher risk for long COVID, but that hasn't turned out to be true. And the other thing is, a negative COVID test may tell you that you don't have the infection. However, some people have found that they can experience symptoms even after they've tested negative. At present, there is no test to detect or predict long COVID. And truthfully, at present, there is no specific treatment for long COVID. However, I will discuss some of the things that we would recommend from the functional medicine world, and people of all ages and fitness levels may be affected. So this was again a very interesting finding, because normally, there was a time when people thought COVID-19 is only a problem of older people who are anyway have an immune system that doesn't work so well. They have multiple illnesses and all those things. But we know that even younger people can get affected, and even younger people, particularly if they are not metabolically healthy, can have a very severe infection. Now, the biggest surprise came from a lot of people who are, and we know about a lot of athletes in the sports world who have got the infection. So, what people found, so some of the description of what they felt is, someone I know was talking about a friend of his who's a cyclist. So she used to, go on bicycle rides all the time. But after she had a somewhat relatively mild COVID infection, she felt that she couldn't go on as long as rides, bicycle rides as she used to before. So this was again a surprise, because most of us think that people who are very fit, who are into sports and they are active and they're not like sitting all the time like couch potatoes, they would not be affected because they are they benefit from better, higher fitness level. But it turned out that many of these people who are working at a high performance levels, they found that their performance was affected as well. So that was again another something that is a surprise to a lot of people. However, we know that just because someone looks, and I'm using air quotes, healthy from the outside, it may not be true inside. So we definitely need to know what is going on. And as I keep saying, there is so much about this viral infection that we don't know yet. So we are none of us are making any claims about these are the things you need to do to be able to overcome this viral infection or overcome long COVID. However, I will discuss some of the strategies that you can implement. Now, this is very interesting because lot of medical literature is coming out these days. And as you can see, from this is just a snapshot of some of the papers that have come out, and there are lots more, of course. So Nature, that's a very well respected journal. The Lancet, neurology. So the lot of neurology symptoms that have shown up in people with long COVID, and of course people who already have an ongoing infection. There have been a lot of effects on the nervous system as well. So what is interesting is I wanted to point out in this Nature paper, they suggested that we should let patients define what is long lasting COVID symptoms, which is very good, because until a few years ago, quite often we did not always factor in the patients and how they felt. And that was how I practiced medicine before as well. But this is very important, because how you as a patient feel is of course extremely important. And for the thanks to technology and the interconnected world, it has become important about taking the patient into factoring in the patient's point of view and how they feel in this whole situation. Obviously, the question arises, how do we explain these long COVID symptoms? Yes, definitely it is an immune system problem, because any illness is an immune system problem, and a viral infection is definitely an immune system problem. The other question arises quite often, because autoimmune conditions are one of my areas of focus. Often I'm asked, is it possible that COVID-19 infection is autoimmune? Of course, bottom line is we don't know yet. However, one thing is, can it trigger autoimmune conditions? Can it make existing autoimmune conditions worse? The data has shown that people who already have existing autoimmune conditions and are on multiple medications are not doing too bad. And I've talked to clinical immunologists and other videos before, which is actually a very hopeful message. So if you have an ongoing autoimmune condition, and you continue with your treatment, you maintain your blood sugar, blood pressure, and all that, you are not going to be at a higher risk. However, it is important to maintain, the physical distancing, the hand washing, and all those things. Those things apply to everyone, irrespective of whatever illness you may have before. So, is it possible that a coronavirus, SARS-CoV-2 virus infection will trigger other autoimmune diseases in you? It is possible. There have been a few cases reported of, GBS and things like that, because we know from other conditions that viral infections may trigger an autoimmune condition. The future will tell us whether that is going to happen or not. At this point in time, it seems it is possible, so we don't rule out the possibility. The next thing is mitochondrial dysfunction. Can mitochondrial dysfunction explain a whole lot of these symptoms? Now we know that, any viral infection, there are a lot of immune inflammatory chemicals secreted. We know about the cytokine storms, which have been all these high levels of inflammatory chemicals, which have made, in severe infection, those have been the problems. So yes, but the fact is, when we talk about inflammation can be at so many different levels. And sometimes the generic term inflammation is like applied without, of course, we have to qualify it and quantify it. And we are not, at this point in time, we cannot say that you do 20,000 tests and we'll know exactly what the picture is and what it means for you. But yes, of course, that is very important. And as we know that, mental health conditions, particularly depression, anxiety, and these things, fatigue, these have been associated with inflammation in the past. So it's not a surprise really that many of the symptoms are related to this. So going back to mitochondrial dysfunction, what are mitochondria? Mitochondria are basically these energy generating, organelles in your cells. So your cells have a mitochondria which produces things like ATP, which is basically your cells, fuel system is what the mitochondria is involved with. Now, there it is possible that it is a mitochondrial dysfunction which is causing all these symptoms. That is another area we can look at. Gut-lung axis disbalance, of course, that is definitely possible because we know that this virus enters through the lungs. So gut-lung axis is intimately related, and I have discussed this on other videos before. Gut-brain axis, yes, we definitely know that is very important. So glial inflammation. And the other thing is vascular inflammation. So is it possible that it's your blood vessels inflammation that is causing the problems? Because we know that there have been problems of vascular inflammation in the COVID-19 infection. People have had extra clotting and all those things. So there are several possible ways to explain, but at this point in time, as far as the knowledge goes, we don't have one thing, kind of one explanation for everything. As in functional medicine, we look at a network of networks possibility. It could be all of them. It could be that one is predominant in some people versus, something else is predominant in others. But the bottom line is, given all these symptoms and given what we know so far about this viral infection, what are the things that we can do? That is what I'd like to focus on. One important thing that I wanted to stress upon is this is actually a very good paper, and this came out in the journal BMJ, and this was primarily targeted to primary care physicians in the UK. But then, of course, everyone can use this. And this is an article, again, it's available open access. So I would definitely encourage you to take a look, particularly this infographic. And if you're a physician who's dealing with all this, this infographic kind of summarizes all the stuff. So, what are the things you absolutely should not ignore is worsening breathlessness. I know many of you have a pulse oximeter at home now. So if you find that your oxygen saturation is going below 96%, or if you're experiencing chest pain or new confusion or weakness of any part of your body, it is very, very important that you seek urgent health care immediately. Do not waste time at home. And the other thing, and of course, in countries where you have access to 911, that is emergency services, you should definitely reach out. So these are symptoms not to be ignored. But besides, let us say you don't have these severe symptoms, but you still have other conditions. What are some of the things you can do? And this particular paper actually, it has summarized those things. And I'm sorry, it got hidden behind the. So one of the things was sleep, quitting smoking, limiting alcohol, limiting caffeine. So next slide, I'm just summarizing some of the things that I will discuss. For me, of course, I come from the world of food. Food to me is signals to your genes. It is signals to your gut microbiome. It is signals to your lung microbiome. It is signals to all the to all the viruses and everything else. So food is primary. Reduce alcohol intake. Excessive alcohol intake can completely, jeopardize your immune system. I have talked about sleep deprivation before. So sleep is again very important for your immune system to function well. Then let us say you're someone who has a lot of fatigue. How can you pace your activities? In subsequent videos, I will talk about these in a little bit more detail. Stop smoking. Again, I know many of you who smoke, you do consider that you know that you do have to stop smoking, but of course you have to look for some kind of a program. It's not always as easy for someone who smokes to just say, okay, tomorrow I'm going to stop smoking. I know for some of you it has worked very well. Others may need more professional help. Then reduce your exposure to atmospheric pollutants. If you are at home, maybe consider getting an air filter. And this is particularly relevant in countries like India, where the atmospheric pollution is so high, and that itself is a risk factor for a lot of chronic disease. Track your symptoms. If you have access to one of the apps, that is wonderful. In the UK, I know they have, Dr. Tim Spector has come up with a program that they are tracking people with these. And I don't think, as far as I know, that app is available for use in India or Canada, but I know there are a lot of others. Even if you don't have access to an app, just maybe if you just like pen and paper, start writing down on pen and paper every morning or every evening. Just review your symptoms. Are you feeling better today? Are you feeling worse today? Or you can put it on an Excel spreadsheet, whatever works for you. Another important thing is, if you are on medications for high blood pressure, heart disease, thyroid, any of the things, or your autoimmune condition, make sure you're taking your prescription medications every day, or the whatever way your doctor has prescribed. Because sometimes some people, because they have experienced brain fog and memory loss and all that, this is something that sometimes gets forgotten. It could also be, of course, definitely your supplements as well. So what are the supplements that we as functional medicine doctors would look at? And again, I keep repeating, there is no data yet which will tell us clearly that yes, these are the symptoms, these are the only symptoms that are going, supplements which are going to work for a long COVID. But I will discuss a few, and discuss on how you decide which ones would be right for you. That will be in part 2 of the video. In this one, I want to focus more on food first, because one thinking which I have always protested against is, some people think that if they take a bunch of supplements, then the basic things like food and sleep and movement and stress reduction, those things don't matter. But in my world, those things are primary. So unless you have fixed those things first, it's not that supplements are going to do some magic for you suddenly. So you cannot out supplement poor lifestyle choices. So this is where food is such a big thing, because we know that people who have diabetes, they have had a worse outcome of the disease. Now, interestingly, some just recently, some papers came out where they looked at, this was a paper from Spain, where they looked at the blood sugar levels at admission. Now, what they found is, these were people who did not even have diabetes, but if they had a higher than 140 milligram per deciliter of blood sugar at admission, they had a much worse outcome of their coronavirus infection. So, bottom line is, will it matter to have lower blood sugar levels? Yes, it will definitely matter. So, what are the different ways of reducing your blood glucose levels? And as you know, you've heard me talking about it. Higher blood sugar levels are very inflammatory as well. And very soon, I'm going to have a group of 3 different clinical immunologists to talk about how blood sugar levels and immunometabolism impacts. Anyway, that's for another video. First of all, start with low carbohydrate food. How low? That would depend on you. Each and every person has a different carbohydrate threshold, and we have other videos on which we talk about. So, basically, what do I mean by that? Now, some of you may do very well by just reducing your present carbohydrate intake by maybe just 100 or 200 grams. Some of you may need to go down to as low as 20 to 30 grams. Again, different ways of figuring that out, I'm trying to just briefly explain here. So what are your high carbohydrate food? Rice, all the grains, then all the vegetables like potatoes, and of course then all the processed food, all the baking that many people have started doing, the sugar, All those are highly inflammatory. What about grains? Now, you'll hear everywhere, people talk about eating a diet of whole grains is very healthy for you. Whole grains or grains in any form are not healthy for everyone. You need to figure out, because some people have found that eating grains makes them, number one, makes their blood sugars go high. And blood sugars, even I have experienced that. I don't have diabetes, but if I eat certain grains like millet and ragi is another one, buckwheat and all that, my blood sugars are in the diabetes range. So that has been an experience for many other people as well. So are grains really that healthy? It depends. You need to find out. What about gluten? Gluten can be extremely inflammatory for a lot of people. Some people have found that dairy, things like maybe it is milk or cheese or paneer, that is cottage cheese, that could be a problem for you. Again, there are no simple answers for these. For each one of you, it is different, but these are some of the areas you can look at. Food sensitivity. That is another area where food sensitivity can increase your levels of inflammation. Again, I keep saying no one has, absolutely watertight data at this point in time, but as most of us in the functional medicine world, we are quite happy to recommend some things without having all the answers. So, of course, lower carbohydrate food, prioritize protein and good quality fat, not trans fats, fat that comes from the processed food and the sugar and all those. Sugar is highly inflammatory, and you'll be surprised to see, maybe for some of you it's just that getting rid of sugar, just sugar and nothing else, can make a big difference. Of course, I know some of you are vegetarians, so it is very difficult for you to give up a lot of the carbohydrates and proteins, because you get your proteins from sources like beans and lentils, which come with a lot of carbohydrate already built in. So that is one area where you need to focus. But yes, maintaining lower blood sugar levels than you have now, if they are outside the optimal range, that can make a huge difference to you. In subsequent videos, I'm going to talk about other things that you can do. So that's all from me today, and thank you.